Having a miscarriage is one of the most terrifying things that can happen to any woman trying to get pregnant. In this Fertility TV episode, I'll be telling you what you can do to avoid a miscarriage. If you are suffering with recurrent miscarriage or you want to prevent one from going on, keep watching. I'm Dr. Marc Sklar, the fertility expert, and welcome to Fertility TV. This is your YouTube channel dedicated to help you believe in your fertility, empower your body naturally to create a pregnancy. I'm here to help you empower your fertility. If you want to talk with me, then click on the eye icon up in the corner, somewhere right around here, or check the links below to schedule a virtual consultation, or just come visit me in one of my clinics here in San Diego. So when it comes to treating miscarriage, the first and most important thing is to understand why a miscarriage actually happens. There's a lot of different reasons why a miscarriage can happen. I've broken it up into 6 different reasons or categories, if you will. So the first one is anatomical abnormalities. This is when something physically is wrong in the uterus or reproductive organs. So in this case, you can have a misshaped uterus. Sometimes it looks like a heart, or it's completely separated. I have several patients like this, unfortunately. You can have what's called an incompetent cervix, where the cervix can't hold the baby in, the fetus in. You can have large uterine fibroids inside the uterus that prevent the embryo from growing, or you can also have severe Asherman syndrome. So these are some really extreme reasons why there could be some sort of abnormality in the uterus that can lead to a miscarriage. Number 2 is genetic causes. Obviously the first part of this whole thing is that we can have genetically, we can be passed down, or from our parents or grandparents, we can have some sort of issue that gets passed down to us, and they've had recurrent miscarriages, and so that gets passed down to us as well. The other reason is that women and men, as they age, the chance of miscarriage rises due to genetic abnormalities that start to happen and cellular degeneration that starts to happen with age. So that's number 2. Number 3 is blood clotting factors. This is a really common one, and actually this one, including with the next 3, are probably the more common ones that I see in the clinic. So blood clotting factors is a big one, I don't want to sound like with all of these cases there's nothing that can be done. There are things that can be done with all of these things, some more than others, but certainly blood clotting factors, there are things that can be done. Number 4 is autoimmune based issues or immune compromised patients, and the fetus in the body, when it starts to implant, the body sees it as a foreign object. And so when it sees it as a foreign object, just like any other foreign object, it tries to push it away. So there's a delicate balance that needs to happen, and when we've got an autoimmune issue, then this can compromise that process and make it more difficult for the embryo to implant. Number 5 is hormone imbalances. So these can be things like low progesterone, and progesterone is an important hormone for holding the pregnancy in the first trimester. High progesterone, high prolactin, and thyroid hormone imbalances or issues. And then number 6, and this is a complicated one, but one that you actually have a lot of control over personally, is environmental factors. So if you're exposed to chemicals, high exposure to drugs, exposure to x-rays, maybe even excessive use, if you want to talk about environmental factors, excessive use of alcohol, caffeine, or smoking, these are all reasons why the environment or the world around us can contribute to a miscarriage. And I'll tack in a second kind of 6A or 7, if you will, which is obesity. If we're overweight, that has shown in some research to have an increased risk of miscarriage as well. So then what do we do once we know this information? Well, once you know that these are the reasons, the next most important thing to do is to test. So with each one of these variables, there can be some lab tests that we can do. Some of them are visual, right? So if we're trying to check what's going on inside the uterus itself, then we want to see that visually in some fashion. These others can be hormone or blood test related, so we're checking for different variables when it comes to immune processes, blood clotting factors, hormone imbalances. We can even do some deeper testing when it comes to chemical exposure or heavy metals or things of that nature as well. And some of it is just reassessing our lifestyle to understand what we're doing that could be impacting this process as well. So again, so the second step is to do a test or evaluate or look deeper into the potential causes that could be impacting. Now, once you know what's causing it, you've done your test, you've done your analysis, you evaluated your health, your lifestyle, and hopefully with the help and guidance of a professional, then once you have that information is power, right? Knowledge is power. And so we want to take that information and then create a plan for how we treat that. The first thing when it comes to treatment that I always like to tell patients is preparation or prevention is the best medicine. It's really difficult, or it's much harder to treat a miscarriage once you're pregnant if you haven't already taken the necessary steps to address the underlying cause. I'm not saying it can't be done, and I'm not saying I haven't done it, because I have, but the likelihood of being able to be much more successful in preventing a miscarriage is to know the information in advance and then treat it ahead of time before you're actually pregnant. And usually we want, about 3 to 4 months for that time frame to be able to lay the foundation and put in the proper work to do that. Some of the key things that I ask patients to do at home, aside from the prevention and preparing, is in 3 separate categories. So the first one is diet. We always have to clean up diet, and with a lot of these conditions, diet can impact a lot of these areas. Second is herbs and supplements. Once we know what's off, whether it's hormonal, autoimmune, blood clotting, whatever it might be, then oftentimes, not always, but oftentimes with a combination of herbs and supplements and a good diet, we can make a huge difference in these conditions. And then third, I have found acupuncture to be tremendously beneficial for patients who have recurrent pregnancy loss. Now, I'm not suggesting that you go out and just start getting on any herbs or any supplements on your own. I do think when you have a condition of this severity with recurrent losses, you do want to be under the care of somebody. You want that guidance, and you want them to be able to help assess the situation and create a plan for you and guide you through that process. And oftentimes, once patients are pregnant, then the diet gets adjusted a little bit, supplements and herbs gets adjusted a little bit, and acupuncture gets adjusted a little bit. So all of these things need to be reassessed once a positive pregnancy test has come about. And lastly, I want you to know that you're not alone. The rate of miscarriage is really high. So if you've had a miscarriage, then maybe you'd be willing to share your story with us in the comments below. And either way, maybe you can also show your support for others who post their comments and their journeys and stories below in the comment section as well. So hopefully you can contribute to the conversation below. To get all the links that I refer to during this video, and to post your questions, then I want you to check out my blog. You can get the link in the description below, in the comment section below, for going onto my blog, which is on marksklar.com. And for more information on how to believe in your fertility and empower your body, then please go to marksklar.com/newsletter, or just click on the little eye icon right here where you can subscribe to my newsletter. And this is where you'll get weekly Fertility TV episodes with all my best tips on how to get pregnant. Excuse me. You'll also get free guides, tutorials, and many other things I only share with my private community if you're signed up for my newsletter. Also, please, if you found this video useful, then show me some love with a thumbs up and subscribe to my channel so you can find out when my next video is coming out. And this also helps to encourage me to keep creating new content just like this to help you get pregnant naturally, all by your lonesome. And if you want to talk with me for a more personalized plan, let's talk. If you need a little bit more guidance, I can be your fertility coach wherever you are with my virtual consultations. Just go to marksklar.com/hope. And remember, you are fertile, you are awesome, and you can get pregnant. Are you looking for a fertility coach? Are you looking for someone to guide you with your personal needs one-on-one? Well, that can be me. If you want more information on that, check it out right here.